So it is seen between the endosteal and the meningeal layers of the dura mater. Okay. Now coming to one of the questions that was asked, most potential route of transmission of inner ear infection leading to meningitis is the endolymphatic sac. I told it is between the two layers of the dura mater, right? The endolymphatic sac is between the two layers. What are they? The endosteal layer and the meningeal layer. Okay, so it won't be a cause of spread of inner ear infection, nor is this vestibular aqueduct a cause of spread of infection. And what is this Hirsch's fissure? It is an embryonic communication between middle ear at the region of the round window niche and the posterior cranial fossa. So the question has been asked, what is the most potential route of transmission of inner ear infection? This is an anomaly. Usually it is not seen. This embryonic, even if it is seen, it has a communication between middle ear and the subarachnoid space. So and it is a route for spread of infection. Okay. Now the answer to this question is cochlear aqueduct, because this cochlear aqueduct is connecting the subarachnoid space with the scala tympani, and this is seen opening into the area nearer to the round window. Okay, now what is the implication of this? Because of this communication via the cochlear aqueduct between the scala tympani and the meninges, the spread of infection can occur from the inner ear, okay, from the inner ear to the meninges, and can result in meningitis, or meningitis can in turn result in labyrinthitis, and this can cause labyrinthitis ossificans. Labyrinthitis ossificans. That is the reason why in a child with a meningitis, you have to do a bara and confirm that the patient has not had a labyrinthitis ossificans. Okay, if there is a chance of labyrinthitis after the meningitis, you will have to do a cochlear implant early on, because after ossification takes place, it will be difficult to do a cochlear implant surgery. Okay, so that's important, and vice versa also can occur. Okay, that is the infection which is coming from the inner ear can spread to the meninges and can cause meningitis. Okay, meningitis can result in labyrinthitis ossificans, and inner ear infection can result in meningitis. Okay, now coming to the receptors within which are responsible for the equilibrium and hearing. First of all, we will start with the receptors for equilibrium. Now, what are these otoconia? Otoconia are actually calcium carbonate structures. Okay, calcium carbonate crystals are seen, and they are seen above. Okay, these calcium carbonate crystals are seen above, and these are seen over the area of the macula. Macula are the receptors for the angular or the linear acceleration. It is for the linear acceleration, right? Angular acceleration is being dealt with by the crista ambularis of the semicircular canal. Okay, so on the macula you have these crystals called the otoconia. Okay, otocorneal debris, and these crystals, since it is present over the macula, it is also known as otolithic organ. The utricle and sacula are also known as otolithic organ. And now you can see there are structures called the type 1 air cell and the type 2 air cell, which are projecting into the calcium carbonate crystals. Okay, and this membrane is what is called the otolithic membrane. Okay, otolithic membrane. Now, how are these hair cells arranged? As you can see, on the hair cells there are these cilia. Okay, and the cilia, which is the tallest, is called the gynoecilia, and the rest of the cilia are called the stereocilia. In assembly, you might have noticed the children are arranged in the ascending order of their height, and the shortest child will be seen in front and the tallest will be seen behind. Okay, so this arrangement is also seen here, with the shortest seen in front and the tallest behind. The tallest hair is also known as gynocilium. And how are they getting stimulated? Okay, as you can see in this figure, you have these statoconia within the utricle and the saccule. Okay, and what happens is that with movement the stereocilium move towards the kinocilia, and because of that movement the electrical signals are getting generated, and this movement is occurring over the area of the stratoconial debris. Okay, and so this is how it moves. And similar movement can also occur in the case of the semicircular canals, and that is happening during angular acceleration, right? The other one is happening during linear acceleration, that is different. Okay, and this movement can be ambulopetal or ambulofugal. When it is moving towards ambula, it is called ambulopetal. Away from the ambula, it is called ambulofugal. Okay, and now what are these hair cells that are seen? They are of two types, the type 1 hair cell and the type 2 hair cell. The type 1 hair cell has got a peculiar goblet cell shape. Okay, it is goblet cell shaped, and here you have the afferent nerve ending in the form of calyx. Okay, you have the afferent nerve, and in the case of the type 2 hair cell you have the efferent nerves. Okay, efferent nerves are seen in the area of the type 2 hair cells, and they are arranged in the form of Boughton nerve endings, Boughton endings, that you will not learn. Just know that type 1 hair cells are being innervated more of afferent or the sensory nerves, whereas efferent is being conveyed to the type 2 hair cells. Okay, this is the type 1 and type 2. Type 1 is goblet shaped and type 2 is cylindrical in shape. Okay, so that's about the type 1 and type 2 hair cells. And when they move, what happens? With the movement, the hair cells are also moving either towards the utricle or away from the utricle. Okay, utriculopiedal movement is also known as ambulopetal movement, because ambula are seen towards the utricle, right? And ambulofugal movements are also known as utriculofugal movements. Now you have the cochlea, which is shaped like a snail, right? Now how is this cochlea arranged? Cochlea is arranged just like this snail that you see here. Its shell you can see, right? Just like that. Here the cochlea is like it is forming 2 and 3/4 or 2.5 turns around a central structure called the modulus. Okay, there is a modulus, and around this it is turning, the cochlea is turning. Okay, and it forms the cochlea, and the number of turns that are seen are 2 and 3/4 or 2.5. Both are right. Okay, so this cochlea, if you take a cross section, if you are cutting the cochlea like this, and if you are examining, you will be able to see it like this. Okay, here in the center you have the modulus, and in the apex you have the iricotrema. It is in the apex area the scala vestibuli and the scala tympani communicate with each other, right? And here you have the 8th cranial nerve going through here, and not just the cochlea it is turning around. You have an osseous spiral lamina, and the spiral ganglion. They are also turning around. Okay, along with the cochlea, the osseous spiral lamina is also turning around like this. Now, if you have seen a screw, you will be able to understand this arrangement better. Okay, the turns of a screw are like the osseous spiral lamina. Osseous spiral lamina are arranged around the modulus, just like this turns seen in the screw. Okay, this picture you can see how this is the osseous spiral lamina here. Okay, and around that you have the cochlea. This is the modulus. Okay, now in this picture you can see how the scala vestibuli and the scala tympani are communicating with each other in the area of helicotrema. If you are stretching that curved one, the cochlea is turning around the modulus, right? If you are stretching it, you will be able to see a picture like this. Okay, where the scala vestibuli is communicating with scala tympani in the area of helicotrema, and this is the aqueduct of cochlea. This I already told you. It is seen nearer to the round window area, It is communicating with the CSF in the subarachnoid space, and because of this aqueduct of cochlea, infections can spread from the inner ear to the meninges. Okay, to the meninges. Now, what do you mean by organ of Corti? Organ of Corti is the receptor for hearing. Okay, and where is this organ of Corti situated? It is seen in the scala media. Okay, if this is the scala media, okay, in the scala media you have got the organ of Corti. Organ of Corti is the structure which is responsible for hearing. Okay, this is the organ of Corti. Now, how is this organ of Corti arranged? As I already told you, there is osseous spiral lamina. Right? From the osseous spiral lamina comes the basilar membrane, and you have the spiral ligament here, right? Here you have the spiral ligament, and medial to the spiral ligament you have the stria vascularis. Okay, this is the stria vascularis that you see here, and here you have a membrane called this is the Reisner's membrane, and here you have the basilar membrane, and from here projects the tectorial membrane. Okay, this is the tectorial membrane. Now you have a tunnel of Corti here, and within that you have the corticolymph. Now the peculiarity of corticolymph is that it is having the composition of perilymph. Okay, instead of endolymph, here you have the perilymph, and here you have the inner hair cell and 3 rows of outer hair cells, and of course you have some supporting cells here. Okay, the various supporting cells are Henser cell, Dayter cell, Boucher cells. You need not know in detail about them, but there are some supporting cells here. That is what you have to know. This is the tectorial membrane. Now hearing takes place because of the shearing action occurring between the structures. The hair cells are having the stereocilia projected upwards, right, and it is projecting into the tectorial membrane. When the basilar membrane moves because of the shearing action occurring when the sound waves goes through the scala visibri and comes out to the scala tympani, because of that there is vibration of the stereocilia over the tectorial membrane, and that is causing the release of the electrical signals. Okay, so that's how the structure of organ of Corti is arranged. Okay, this is the organ of Corti, and here you have the tectorial membrane. This is the Reisner's membrane. Okay, osseous spiral lamina you see here. This is the tunnel of Corti, and here you have the outer hair cells. These are the supporting cells. Okay, so this picture of organ of Corti, it is very important, not just for your theory exams. This also asks for entrance exams. Okay, questions may be asked. Now, how are these inner hair cells and outer hair cells different? They are as different as the type 1 and type 2 hair cells. Okay, type 1 hair cells, I told you, they are like the goblet cells, like these are the goblet cells. Just like that you will be able to see the inner hair cell. Okay, inner hair cell are also goblet in shape, just like the type 1 hair cells. Type 1 hair cells are similar in shape to the inner hair cells. They are also goblet in shape, and they have mainly sensory nerve fibers or the efferent nerve fibers similar to the inner hair cell. Okay, and here you have the outer hair cells. Outer hair cells, they have more of efferent nerve fibers. Okay, afferent is also there, but more of efferent nerve fibers, because the major function of outer hair cells are in modulating the function of inner hair cells. Okay, and here you have the stereocilium and the kinocilium. Now when the stereocilia moves towards the kinocilia, there is depolarization. When it moves away, there is hyperpolarization. Okay. Now let me ask you something. What are the various structures and what are their functions? Bony labyrinth. In the bony labyrinth, you have got the semicircular canals, right? The bony semicircular canals. Correspondingly, you have the membranous semicircular canals. Okay, now what are the sensory epithelium known as? I already told you, canal for crista, C for C, and they are seen within the ambulated ends, and hence it is called crista ambularis. Now the function is in angular acceleration. So it is in angular acceleration. Now the next structure that you see in the bony labyrinth is the vestibule. Okay, vestibule. Vestibule is a part of the bony labyrinth. The bony labyrinth, you have the cochlea, the vestibule and the semicircular canals. Okay, and in the vestibule you have the utricle and saccule. Now what is the sensory epithelium? The sensory epithelium is called the macula. And they are responsible for linear acceleration. The utricle with forward and backward movement and the saccule with upward and downward movement. Okay, now what else do you have here? The semicircular canals, vestibule, then you have the cochlea, right? Cochlea. The membranous labyrinth, you have the cochlear duct or the scala media. And within that, which is the sensory epithelium, it is being formed by the organ of Corti. Okay, and it is responsible for hearing. And you have the vestibular aqueduct. It forms a covering over the endolymphatic sac. Okay, in the lymphatic sac and the duct, it forms the covering, this vestibular aqueduct. It has no sensory epithelium. The main function is in absorption. It has got an epithelium, but it is having the function of absorption. There is no function of over hearing or equilibrium. Okay, absorbs the endolymph. Okay, so that's in a nutshell about the various structures within the inner ear and their functions. Now, how is it being innervated? The type 1 and the type 2 nerve fibers are also there for innervation of the inner hair cells and the outer hair cells. I told you the outer hair cells are more in number. They are arranged in 3 rows and they are having more of a different function, right? And it is more clear if you look at this picture. Okay, in this picture you can see that one nerve fiber is going to innervate multiple outer hair cells. Okay, and that one nerve fiber is the type 2. I already told you type 2 hair cell in the labyrinth, the semicircular canals and the utricle and saccule are similar to the outer hair cells, right? Inner hair cells are similar to the type 1 cells. So similarly, the type 2 nerve fibers are branching into multiple branches and are innervating the outer hair cells. Okay, they innervate the outer hair cells, and the inner hair cells are being innervated by the type 1 fibers. Okay, there are multiple type 1 fibers going on to innervate a single inner hair cell. Okay, multiple type 1 hair cells, multiple type 1 nerve fibers. These are the nerve fibers. Okay, multiple type 1 nerve fibers go on to innervate a single inner hair cell. Here also you can see the same thing, how the inner hair cells are being innervated by multiple nerve fibers, whereas outer hair cells are being innervated by branched portions of the type 2 nerve fibers. Okay, type 2 nerve fibers. And the outer hair cells are more of having efferent nerve fibers, and the afferent nerve endings are going into the inner hair cells. Okay, afferent to inner hair cells, and to the outer hair cells you have efferent. Okay, that's about the anatomy of inner ear. Now we have one last thing to be covered in the anatomy of inner ear, and what is that? It is the blood supply of the inner ear. How is the inner ear being supplied? Inner ear is being supplied by the various branches of the internal auditory artery. What is this internal auditory artery? Internal auditory artery is nothing but labyrinthine artery. Okay, internal auditory artery is the other name for labyrinthine artery. And this labyrinthine artery, or the internal auditory artery, is a branch of anterior inferior cerebellar artery, which is a branch of basilar artery. Okay, ICA is a branch of basilar artery, and this internal auditory artery further divides into common cochlear artery and anterior vestibular artery, and they go on to supply the cochlea as well as the semicircular canals. Okay, after dividing into common cochlear artery and the anterior vestibular artery. Okay. So what have we learned today? We have learned in detail about the anatomy of inner ear, how the inner ear consists of the bony labyrinth, which is protecting the membranous labyrinth, within which we have the delicate structures which are responsible for hearing and equilibrium. And what are these structures? We have within the semicircular canals the crista ambularis, which is responsible for the angular acceleration and the signals being conveyed when an angular acceleration occurs. And you have the macula within the utricle and saccule, and they have the type 1 and the type 2 cells. Okay, and what else do you have? You have the organ of Corti. Organ of Corti is seen in the scala media, and it is situated on the basilar membrane, and on the basilar membrane you have the two types of cell, the inner hair cell and the outer hair cell. And what happens? The similar to type 1 and type 2 cells, where you have the serosilia moving towards the kinocilia, such movement occurs. The difference is that this movement is occurring during angular acceleration and linear acceleration in case of crista ambularis and macula respectively, whereas the movement is occurring due to the movement caused by the hearing. In hearing, the foot plate of stapes goes over the oval window, and that is causing vibrations in the scala tympani from the scala vestibuli, and that shearing action is causing the movement. Okay, so that is what is causing the movement here, and that is responsible for the hearing. And we also learned about the blood supply of the inner ear, and also about the development of inner ear and the various developmental anomalies associated with inner ear. In the next class we will be learning about the physiology of hearing, and then we will learn about the physiology of equilibrium. Okay, for now, bye bye.